Something powerful happens when local ministries are seen, known, and connected. That's why Lauren and I launched the Cleveland Ministry Collective. Born out of a moment when national Christian media walked away from local communities, we're building something new. We've got a central database of Northeast Ohio ministries and a master calendar of events happening in our area. And we're using the Third Place podcast to uplift local voices and tell the stories that matter here at home. If you want to be part of a movement that puts community first, visit clevelandministrycollective.org and donate today. That's clevelandministrycollective.org. Joining us now on the Third Place podcast is our friend, Dr. Steve Grcevich. He's a retired local child and adolescent psychiatrist in Northeast Ohio, and also the president and founder of Key Ministry. Dr. Grcevich, welcome back.
Well, thank you guys for having me back.
Now, if people have not checked it out yet, they have to go check out your Substack, because you've made this a big part of your retirement work, is that you're writing regularly, publishing. How do they find the Substack?
Child Psychiatry for Christians is what it's called, which is, easy to remember. And if you know my name and search that out on Substack, Grcevich.
Well, and on top of that, what I like is that you're not just going in there and writing cute little articles about nice mental health things. You're willing to tackle difficult issues in culture tied to mental health. In fact, it seems like it's not you're willing to, you want to.
Well, I think that someone needs to be able to speak into some of these controversial issues from a Christian perspective. Recently, there was, a lot of publicity around Dr. Dobson's passing.
Yeah,
That was a role that he had in a previous generation, and sadly there are very, very few Christian folks who have become, especially evangelical Christian folks, who have risen to roles of prominence in the mental health community, so that if one of the services that I can provide in addition to doing what we do through our ministry is to be a, credible and responsible source of information to the Christian community around some of these issues that impact our kids and families, then that's something that I'm privileged to do.
And you have the wonderful advantage of, if any medical establishment gets upset, you say, go ahead, take my license. I'm retired. Right? You're not worried about losing your license.
Yeah, exactly. But kind of like the way that Paul went off and kind of was talking about his qualifications and his credentials. I have a few of those that I can use when I need them.
Just a couple. Yeah, I don't know, which is one of the reasons we love chatting with you. Okay, so one of your recent Substack articles ties to a trend beginning in the country that we saw pop up first now in Illinois, where the Illinois state legislature is creating this really required mandatory mental health screening for all public school students.
Yes, mandatory mental health screenings for all public school students beginning at third grade, taking place annually through the end of their senior year.
Now, on its surface, you kind of go, well, all right, we're in a era of increased awareness of mental health. We're in an era where kids are very anxious, dealing with some mental health issues at a higher rate than before. Somebody might go, this sounds great. Must have been a short article, right? It's like, way to go, guys. You did it.
Well, again, maybe I shouldn't put it this way, but let's just say the devil's in the details.
And that's usually the case, especially with legislation, because on its surface, I like the idea of kids getting mental health screening, especially if they're impoverished kids whose parents may not be in a position to get them the help that they need. Okay. However, the problem that Illinois has, of course, as they're doing this is they can't implement this yet because you have to create a whole bureaucratic system in place to be able to do it.
Yeah, so they're not doing this during the current school year. I think the bill itself passed and was signed by their Governor Pritzker July 31st. So that they're taking this year to kind of figure out what is this going to look like? What kind of screening questionnaires or tools or instruments do you use, for kids that, at what age, then you start getting into issues where like, well, what are you going to do with the information? Are you sharing this with parents? What message or what interpretation is going to go out, with like the results of these screenings? Cause like, like when your kid is in school, and they're taking like the proficiency test in reading, you get a chart that gives you like a numerical
Yes.
score that kind of explains to parents like where they fall, like relative to their grade level. What are you going to be using? What are you going to be communicating to parents, and how do you help parents to make sense out of whatever you're using?
Well, and my first question is much more practical in the who's going to do it. Because, if I think about my time in secondary education, we had a school psychologist. I can't imagine that they could get through all the students. We had guidance counselors. I'm not certain guidance counselors are qualified to diagnose mental health disorders.
See, my guess is that probably what all of this is going to be is online screening tools. Like if you notice, like, if you've been to a doctor in like the last year or two, like, if you're going to like, the clinic or like one of the big systems, before you check in for your appointment, they direct you to like a website, and they have all kinds of like web-based questionnaires. So I would strongly suspect that that's what they're going to be doing with kids, and that they'll be on like an iPad or on their Chromebook or whatever they're doing in school, and that they're going to be required to fill out whatever instruments or rating scales they happen to pick.
Well, and so I guess that begs the next question, which is, are there diagnostic tools available in that format that you as a psychiatrist would say, oh yeah, that's a good one. I like that. That's going to work great for this purpose.
So that if you look at, say, like some of the kinds of things that are being used like in pediatric practice now, because like this was like a big push from like American Academy of Pediatrics. There are certain like screening tools that they like incorporate now, into like the checkoff list, like before you have like a pediatric appointment. Like a real common example of this is something called like a PHQ-9. It's 9 questions, sort of like screening tool. I mean, they're looking for like
9 questions. That's it?
Yeah, that's why they call it a PHQ-9. Yeah. And interestingly
You can't
enough,
do 10?
it was created, interestingly enough, by Pfizer Pharmaceuticals. At the time that they were making Zoloft as as an instrument for docs to use, that people could fill out quickly, that would highlight the need to ask more questions about depression or suicide risk.
But if it's made by a pharmaceutical company, it's already a biased survey, right? Because wouldn't their motive be to make sure that more people are medicated?
So I'm not sure that I would use the term biased, but one of the issues that you get into when you start looking at a lot of these kinds of screening tools is that they're sensitive, but they're not specific. And so like when we look at that, and like we look at like a test in medicine, like if someone has a problem, they will probably score out high on like a PHQ-9. So if somebody's like walking through your office door, and if this is a kid who's like, severely depressed or suicidal, the likelihood that most or a very high percentage of those people would be identified by this screening tool is high.
Okay.
But it's not specific, in that you're going to get a lot of false positives from a lot of these screening tools.
And does that concern you as a clinician?
Well, I'll tell you why it concerns me as a as a clinician. So the one of the issues that we have, like when you start thinking about this issue of like mental health screening, and you get a kid where like a red flag comes up. Well, what do you do with that? And so like, I could see the school like generating like an email to a parent saying, your child scored above this cutoff, on the PHQ-9, that this could be an indication of like depression or some possible suicidality. We encourage you to get this evaluated. And so we already have this overwhelming shortage or issue with access to appropriately trained mental health professionals now. If you start screening every school age kid for certain problems. And you have these tools that are designed to, red flag everybody who has a problem, but also, again, create a lot of false positives. What does that do in terms of impacting the ability of families to access services who really need them?
Yeah.
So now you're scaring a bunch of families
Yeah.
with a potential false positive.
Yeah, with a potential false
And
positive.
they won't be able to get,
And-
for 6 months maybe,
Well-
seen by somebody.
Well, yeah, I mean, I know that, like, having, done a little bit of my medical training in the city of Chicago, I know that, like, compared to other parts of the country, psychiatrists may be a little more plentiful there, but that's not true, in most parts of Illinois or in most parts of the country. So that's one piece of it. Now, a second piece of this is that for more and more of our young people, and this has in particular been a trend in the young adult population, kids are running with the ball, sometimes self-diagnosed, a lot of times after having been formally diagnosed, and are incorporating their mental health diagnosis into their identity and building an identity around around their diagnosis. And so that one of the things in the context of the culture that we find ourselves in that we have to be really careful about is, in my mind, the purpose of a diagnosis is that when you have someone who is truly in need, it helps you to organize your thoughts as to like what might be most helpful in their situation and to come up with like a plan to go ahead and address it. When you have kids sort of in our culture with social media that are looking up all kinds of stuff on the internet, and they're taking some sort of screening tool that suggests that they might have ADHD or that they might have anxiety, how much of like what they read and what they see starts to become a self-fulfilling prophecy.
Interesting.
Yeah, so that, and again, I have no idea like what they're ultimately gonna like select in Illinois, but like a common like screening tool in pediatric practices for ADHD is something called like a Vanderbilt rating scale. You give something like that to all of your kids, and someone who's never had a diagnosis scores out high, reads about ADHD, and then starts, procrastinating on their homework, not turning things in, showing up late.
And saying, oh, it's my ADHD. Sorry.
Mm-hmm.
Huh. Wow. And what's wild to me, Lauren, is that if this trend continues across the country, your sons will be the first ones to be experimented on. Because her oldest son just entered kindergarten.
Mm-hmm.
And it's not beyond the realm of imagination that by the time he gets to third grade, you said that'd be the first eval?
Well, in Illinois, they're going to start screening kids in the third grade.
So how do you process that initially? Hearing that this your boys may have mental health screenings without your knowledge even? Because that's part of the problem.
They have to tell parents, right?
Well,
I mean, if like it's a law that your kids are doing this at school, parents know that it's happening. Maybe they don't know that.
Well,
like,
yeah,
when it's
parents
happening.
know that it's happening, but again, like, does a parent have the opportunity to opt out of
sure,
this?
yeah.
I mean, because think about like some of the controversies that are going on now around the country in terms of parents wanting or choosing to have like particularly their very young children opt out of conversations about sexuality and gender.
Yeah.
I know that this has been like a real hot topic, like on the East Coast, Washington, D.C. area, with some of the school systems in Northern Virginia. So what does the process involve, what's involved with opting out? One of the other issues, and I know that there are FERPA laws sort of similar to HIPAA that have to do with the confidentiality of certain medical information. But what exactly are the schools going to be asking kids? So that when you think about like one big area of focus now in like children's mental health, it's like, ACEs, adverse childhood experiences. So how much are we going to ask them about trauma? Are we going to start asking about, like, do your parents spank you? Do your parents yell at you? Like, how in depth are we going to be getting into with questions about what goes on in the home? Mm-hmm. Where does that information go? Who has access to that information? And keep in mind that schools are mandatory reporters when it comes to suspected child abuse. And so, depending upon how kids phrase things, how they communicate things, what specifically you're asking, with like whatever screening tools the state Department of Education, ultimately decides to use, like, how confidential does that information stay? How much information are schools going to be seeking to extract from their kids about what goes on in the home, and what the schools ultimately do with that information?
Lauren and I want to take a brief moment before we continue today's episode to thank our sponsors. First of all, did you know I have a brand new morning show? That's right. It's called Upliftd Mornings with Brian. And our sponsor is Upliftd Stream from KHCB Media Group. We're so grateful for their sponsorship and their attention to my new morning show. Check it out weekdays from 6 to 8 a.m. Central, 7 to 9 Eastern. We have a lot of music, worship music. We've got scripture. I have devotional thoughts, try to share some funny stories, dad jokes, Bible quizzes, things like that. For more information how you can listen to my new morning show on the Upliftd Stream, just go to upliftedstream.org. That's upliftedstream.org, or just download the KHCB mobile app. We also want to thank our sponsor, JLP CPAs. If you're a small business owner, you already wear dozens of hats. You don't want to have to worry about things like taxes, payroll, financial reporting, budgets, balance sheets, all those kinds of things. Let our friends at JLP CPAs take care of that for you. They're a firm focused on small businesses. They're a local Northeast Ohio company, and you ought to check them out so that you can focus on what you're good at in your small business. For more information, go to jlpcpas.com. Again, jlpcpas.com. And finally, we'd like to thank our friend David Safransky and Edgewater Investment Group for being a sponsor of today's episode. Have your finances been overwhelming? Are you stressed about your future? You should talk to Dave and his team at Edgewater Investment Group. They'll help you with things like budgeting, retirement, investing, and they'll be honest and straightforward. So you want more information about how you can get connected and get their help with your future financially? Go to edgewaterig.com. Again, that's edgewaterig.com. Thanks again to our sponsors, and now we'll keep going with today's episode. Can you imagine a scenario where there would be a way to set this up, let's just say in our area, in the Cleveland area, where you could give your Steve Grcevich seal of approval, like, I could support this? Or are you saying there's too many risks involved to do it well?
I'm saying that I think that there are an awful lot of questions that folks need to address, so that if a parent were asked about this, like, I think that first off, there shouldn't be this type of screening without parents explicitly having to give consent. So one of the points I made, like in my Substack, and for purpose of full disclosure, is that our younger daughter works for Child and Adolescent Behavioral Health in Canton. And a part of her job is that she goes into schools and is providing mental health support and doing prevention work with at-risk kids in Stark County. Now, one of the things about the program, the way that it's set up in Stark County, is that, before kids are able to access these services, their parents explicitly have to consent to them. But again, I think that one key issue is that this stuff shouldn't be going on without parental permission, because it's not as benign as people make it out to be.
One of the things that I get asked to do fairly often, because I'm on like different like lists of like educators and professors, is that like when college students or graduate students are doing certain studies where they're looking at a treatment or different kinds of phenomena, I get probably once a month some sort of survey to fill. Every institution has an IRB that has an informed consent, and they talk about like even like the risks and benefits of being able like filling out like online questionnaires. I mean, so that's sort of standard operating procedure, like when you're doing clinical research. And, you know, as we talked about before, like when you have kids who are sort of suggestible and in a culture where kids are prone to, you know, incorporate different mental health concepts, ideas, you know, possibly like into their identity. Again, it's not, you know, it's not a benign kind of intervention. Again, like the next question then comes up, like if you're doing screening, like what are you doing in response to that? Mm-hmm. And so one thing that I think would surprise a lot of parents in Northeast Ohio is just how common this phenomena has become in terms of having like mental health clinicians and mental health practitioners in the public schools, and even to some extent in the Christian schools. And so one of the ways that this got started is that about half of the kids in the state of Ohio, their healthcare benefits come through Medicaid because the families make below, you know, a certain income level. And so that in a lot of like the larger cities, they would partner together with like the community agencies that were licensed to accept Medicaid. And they're putting like, you know, counselors, case managers, you know, folks into the school to be able to provide these kinds of mental health support. But it's even extended and grown to the point where you have these folks in the more affluent school systems where the vast preponderance of families have the capacity to, you know, they have, you know, private insurance that covers this, you know, or they have, you know, the capacity to be able to like pay cash out of pocket. So that most schools have, you know, someone affiliated with a mental health agency now already working inside of them who presumably like kids would get referred to.
We have a counseling agency at our school.
Yeah.
Oh, interesting. Mm-hmm. Are you asked about giving consent for your child to be evaluated or spoken to? Or is it just a standard part of the screenings?
You would have to say that your kid wants to go see the counselor.
You'd have to opt in.
Yeah. They don't just go to the counselor.
Yeah, exactly.
Whenever.
That's how, I know that's how it works in Stork County.
It would be like, our child needs extra help. He has a counselor at school. You'd start with a guidance counselor. She would help you get to the actual counseling agency that is at the school.
Okay. Mm-hmm. How do you feel? And are you okay with that as long as it's an opt-in?
I'm okay with that as long as it's an opt-in. But one of the things that folks need to understand is that a lot of times the folks who are working for these agencies don't have as much training as you think they would. I mean, like our daughter has a bachelor's degree in psychology. Because of like the way that Medicaid works in Ohio, that, you know, because she's connected with like, you know, an agency that's accredited by Medicaid, they're able to go ahead and like bill for her services. And, you know, I would hope that Mira has probably learned a few things over the years from like, you know, sitting around, you know, the kitchen table. But again, like a lot of times these folks don't necessarily have a whole lot of training. And one of the things you worry about, you know, with like some of the schools with like their focus on like, you know, mindfulness and, you know, helping kids to like identify their feelings, is that there are certain kids where that makes things worse as opposed to better. If you have a kid who tends to think too much about things, you know, or a kid who ruminates, or a kid who has a hard time letting stuff go, intensifying their awareness of their feelings and their emotions before they have been taught the skills to be able to stop thinking about or letting go things that bother them is potentially very counterproductive.
Huh.
Yeah, and so that one of the concerns again about some of the places where people are working in the schools is that they may not have like a lot of these people are not like independently licensed as counselors or social workers or psychologists.
So what does a bachelor's degree in psychology, for the example of your daughter,
Yeah.
what does that qualify you to do as a clinician?
So some of the things that she might do is that, that they have like different curricula and things that they would be using to help kids maybe, to, learn ideas for like, sort of managing, like, helping them with like helping them to improve like their self-control, to better like regulate their emotions. I know that one of the things that they're involved in is like some like parent skill training, types of things that they're working with families. I know that this past week she's been at different like, back to school open houses, and they're talking to families about their services, and the parents are consenting and like signing up for these services at these activities. But again, like one of the challenges is that sometimes, again, like depending upon like the level of the training that these folks may have, it's the quality of like what they're getting is going to vary a lot, and or these people have like the level of sophistication to like recognize maybe like when they're doing some things that might be making things worse as opposed to making things better.
Because to be a counselor in most states, if not all states and counties, you have to have a license, right?
Yeah. I mean,
That's
you're,
beyond a bachelor's degree.
exactly. Yeah, you're licensed. Yeah, you're licensed. You have a master's degree. In Ohio, you have to have a certain amount of supervision after you have your master's degree, or if you've got like a doctorate in psychology. And before you're independently licensed, it's like 1,500 or 2,000 hours.
gosh.
I mean, it's fairly substantial.
Well, and that's where, I mean, I knew enough that those were in existence, that when Sarah and I were looking for marriage counseling, I specifically targeted somebody with the licensure of a marriage and family therapist. Because I don't want somebody that's just got a bachelor's degree and a little bit of training who doesn't know specifically some skills to help a married couple. So, and that's to your point, right? That you want to be sure we're aware of who's evaluating our kids and what their skills are.
Yeah, and so like when you're talking about like, well, what would allow me to like, give them like the Grcevich seal of approval,
Which I'd like at some point, by the way. But.
One of the other issues, and like this had a lot to do with like how I ran my practice in the day, is that like I couldn't see kids without their parents. I needed sort of the, the additional like source of information, that the kids are not necessarily the most self-observant or accurate people in the history of Earth in terms of describing or representing what's truly going on. And so the more data points I had, the better. And so one of the things that I think is a red flag is if you're looking at a situation where kids would be directed to mental health services without the opportunity for their parents to be actively involved.
Yeah, and I mean, to your point, one of my children at some point, I'll be as generic as possible, met with a psychiatrist, and I was along with that person. And I felt from the psychiatrist that my observations and my thoughts were just as valuable as that of my child, as this person was collecting information to try to diagnose or at least assist in a situation where you don't have the benefit of, let's see, an x-ray, broken bro. We got a broken leg here. You don't have that benefit.
I'll give you a great example of this from having done ADHD research. If you're doing an ADHD research study, the least accurate informant is the person themselves.
So what do? You have to talk to friends and family.
So that like the data that you would get from like if you had a kid with ADHD, the data that you get from their parents and from their teachers is more reliable than the data that you get from the kid themselves.
Yeah,
and so that you need to have other sources, and you need to have the parents involved if you're going to do good work.
Yeah, and after my wife's ADHD diagnosis, there was years of her of going like, wait, so when you do this, you're thinking that? Like she just had, like you're saying, she didn't have this awareness of the way she was thinking about the world was divergent from the rest of the world. And so she probably wouldn't be the best person to self-report.
Well, yeah, and so like back in the early days of my practice, before like the first few years, I would occasionally see some adults before I focused entirely on kids. And when I would have somebody come in for ADHD evaluation, I mandated that they bring their spouse or they bring their mom.
You mandated it.
Yeah, because like, at the time, I mean, now there has to be some evidence of symptoms present by the age of 12, and back in the day, like prior to the DSM-5, prior to 2013, you had to have symptoms by the age of 7. And so that again, knowing that a lot of times, even these adults are not necessarily great observers of themselves.
Yeah.
Having mom coming in with like all of the report cards from like Catholic school, with all of the comments from like sister whatever was like really helpful, because like when you start like digging through like some of these old records, that's where you find sort of like the red flags or things that maybe are indicators that there was an issue, because like, individuals who have stuff can be sort of selective in their reporting and selective in their memory. And I think that the third piece of this is that it has to be clear that when you're doing this kind of like screening, or you're offering these kinds of services, that the child's ability to attend that school is not contingent upon the parent's willingness to consent to these things.
Oh, I see.
Yeah.
So it's not, we're going to kick you out if you won't do it.
Yeah.
And I could see, if I'm going to be optimistic, I could see a world in which it's done properly and it could be helpful for kids. But you're right, it's like a minefield, it sounds like, where there's so many ways it could go wrong and not be effective at all.
Yeah. I mean, like, we're literally like the devil's in the details. Now, again, one of the encouraging trends that I have seen in the last couple of years, and this is like after venting on your old morning radio show about it, is that the Christian schools in our area are really stepping up and are doing like a nice job of being able to address the needs of some of these kids with issues. So that I know that, like, for example, like, Kara Daly, who's a psychologist on the west side of Cleveland, used to be on our ministry board, that there are professional people from her practice who are based in different Christian schools on the west side.
That's great.
I know that again, like, some of like the east side places, like Cuyahoga Valley Christian Academy, like now has like an Oasis program to be able to support kids, with like learning and emotional differences. That the folks at Heritage Christian, have, brought in consultants to help them both with like mental health and general disability inclusion.
Yeah.
In their school. So, I mean, if it's like trusted people with trusted resources, from parents who have already sort of volunteered their kids for Christian school, I would have a lot more confidence in that than perhaps something from the state of Illinois, where they have all kinds of other government mandates about affirming kids who have gender dysphoria and other interesting concepts.
Mm-hmm.
Very good. Dr. Steve Grcevich, again, is president of Key Ministry and a retired child and adolescent psychiatrist. If folks want to get connected to Key Ministry or find your Substack, you got to make sure folks know where to find you.
Okay. Yeah. So again, like if you like do Substack Child Psychiatry for Christians, Google will take you there. It's keyministry.org. And again, we provide lots of free training, resources, consultation, support to churches around the country and around the world who are interested in welcoming, kids with disabilities and their families into the church.
Wonderful. Thank you again for your time and for coming into the studio. We always love your insights and expertise, my friend.
And thanks for all you guys are doing.
You bet. Again, that'll just about do it for today's episode. We got to remind folks to check out our website and maybe find out more about Patreon.
Yeah, so go to stainedglass-media.com for all of our podcasts or projects, or if you want to become a sponsor. Be sure to rate, review, and subscribe so other people can find us. And also, if you love the show, become a member on Patreon for $5, $10, or $15. You're going to get your money's worth if you listen to today's Cold Open. We talked a lot about mental health and kids, and you're going to want to join that and check that out. $5 on Patreon, patreon.com/thethirdplacepodcast.
All right, so that does it for today's episode of the Third Place Podcast. Hey, before you go, don't forget, This episode was made possible through our brand new nonprofit, the Cleveland Ministry Collective. If you want to support our efforts to connect and uplift Northeast Ohio ministries, would you consider a tax-deductible donation? We could really use your help launching our new ministry. Give today at clevelandministrycollective.org. That's clevelandministrycollective.org. Talk to you next time.